Okay, we are live. So, good afternoon, everyone. I am calling the Greater Boroughs Partnership for Health Advisory Board meeting to order. It is September 12th at 1:33. So we will just do a roll call to start the meeting. Southborough,
Present.
Westborough,
Ray Goth, you're in for Jen Sullivan.
and then Boylston. Anne Marie, can you just say present? Okay, Isabella, Northborough, present. Anne Marie, can you hear us? All right, we do have quorum without her, so we'll keep going. Chelsea, right? Is that okay?
Yes, you're good.
All right, perfect. Well, it is, oh, hi, Anne Marie. Can you hear us? Okay. All right, we will keep going. I'm just going to share my screen, but it is so nice to see everyone. I know we were busy this summer with our IMA and all of those fun things. So I am just going to pull up some slides. Let me know if you can see my slides.
Yes.
Okay, perfect. All right, so today we're just going to talk a little bit about the Public Health Excellence Grant in terms of our work plan, as well as our hiring updates and status of that. And then we will have a presentation by Rachel Friedman, which welcome, she is here today. She was our summer Department of Public Health intern, and she is presenting on her maternal and child family health project. And then we just have some updates about public health nursing, and then we will conclude with a conversation about substance use prevention work. So here is our approved FY25 work plan. So again, the last time we met was in June. So we now have an approved budget work plan, as well as work plan and budget, basically. So these are the main things we're focusing on. I won't read these in depth because we did go over these in June, but we kind of are focusing a tiny bit on everything. So we have some maternal child health, tobacco use, disease control, environmental health, and then the first three are more on communication, inventory, just to make things move a little bit easier and a little bit more streamlined. Does anyone have any questions about the work plan? All right. So I don't have a slide for this, but our hiring update. So we do have 3 Greater Boroughs positions listed currently. So we have a part-time shared service coordinator, a part-time regional epidemiologist, as well as a full-time regional public health nurse. So those positions have been posted for about 10 days, 2 weeks. Right now we have 3 applicants for the nurse, 4 for the shared service coordinator, and then 7 for the epidemiologist. So I have been going through those along with our North Boroughs Town Administration, but we are hoping to schedule some interviews in the next couple weeks. So I did just want to briefly touch on that. So I reviewed our IMA, and we need a unanimous vote for the shared service coordinator. At our last meeting, Jen had expressed interest in interviewing the shared service coordinator with and I'm pretty sure that was okay with everyone. But I did want to get everyone's ideas on how to best get a unanimous vote. One suggestion is to have us interview and then bring our top choice back to the group in a special meeting, and then vote from there. But I am open to ideas. I just want to plan so we don't postpone anyone's employment.
I think process-wise, that makes sense, Isabella. I think, at least my opinion is if you have 2 finalists that you want to bring forward because you think that either would do a great job in the position, I'm okay with that too. I think I trust what you and Jen would bring forward for either 1 or 2 finalists. But I think if you can kind of run the process outside of these meetings, so that way we would just have one or two to pick from. I think that makes the most sense.
Just a clarification question, Chelsea, about that. Did you want them to come to the meeting and have us then interview them, or just have them bring back the information and we can discuss the choices then?
So typically, when I've been involved in these processes, we interview them in public. I don't think I've been part of a process that has two anyways. If it's one and you're comfortable with the one, Isabella, then I don't have an issue with then bringing it to this board for approval.
Thank
But
you.
I think if you have two, then I would suggest that we have the opportunity to interview them. I think it'd be difficult for us to decide just on paper.
Agreed. Okay. Ray and Anne Marie, any ideas, thoughts?
No, I'm fine. If Jen's gonna be involved, she'll be the one voting, so I'll take a back seat.
Perfect. Anne Marie?
Yeah, me as well. I trust what you are in the position, or I trust your professionalism.
Okay, perfect. So similarly with the epidemiologist, granted that person, they might be the same. We did have I think most people who applied to the shared service coordinator actually applied to both positions. So it possibly could be a full-time position, them just doing both jobs as I did. So we'll bring that information as well back to the group. I do think it would be wise to schedule that special meeting. Just so again, we don't wait and lose some applicants that have already applied. I unfortunately will not be here until October 14th, and I am hoping to do these interviews in the next 2 weeks. So if anyone wants to volunteer to lead the meeting, the special meeting, that would be great. So you guys can keep moving the process along.
I'm happy to lead the meeting, Isabella, unless Jen wants to as vice chair, but seeing as she's not here, I can be the backup if she doesn't want to do that.
Okay. Perfect. Do you all want to pick a meeting? So my goal is to do interviews. Finish the interviews the week of the 23rd. So ideally you guys would be good to go to schedule a meeting for the first or second week of October. Does anyone have a preference?
I don't think that I do, but if you're not going to be there, Isabella, I would want to make sure that Jen's available.
Okay. All right.
So maybe we can just put out a doodle poll for that or
Okay.
something.
All right. I will create a doodle poll. All right. And then
Excuse me, sorry, Jen's gonna jump on now. I told her, she just came back from a meeting. She's gonna jump on because I told her you were talking about the interviewing process and all that.
Perfect. All right. Then we will hold our thought on that.
She told me she was jumping on, but
No worries.
I don't want to hold up the meeting if
No worries.
she
Well, I guess I can talk about the nurse as we wait. So we have, again, 3 applicants for the public health nurse. I do think it would be wise to have someone from the advisory board to help out on these interviews because I am not a nurse and I do not know all of the roles. So I don't know if anyone's interested in helping me out with that. That would be great.
I would recommend Taylor do that. I think, Taylor, if you're okay with that, I just kind of.
I am.
Okay.
Perfect. So, Taylor, depending on your schedule, I will, here's Jen. I will reach out with the date and the times. Hopefully, I think it's gonna be either Monday or Tuesday of next week.
Okay, thanks.
Hi, Jen.
We just have a 9 a.m.
Hi.
board meeting on Tuesday, so if we can just avoid that.
Yep.
Okay, thanks.
Sorry, I'm late.
No worries. You had a busy day.
Yeah.
know what time it is. So Jen, just to catch you up, so we have some applicants for the shared service coordinator, epidemiologist, and the public health nurse. Last time we met, it was going to be me and you doing the interviews for the shared service coordinator. Most of those applicants also applied to the epi position, so we'll just do them both at the same time. So we were just talking about a process for bringing that information back to the board because it does need to be a unanimous vote for the shared service coordinator.
Okay.
So our goal was to set up a special meeting, very quick meeting, just to, well, could be quick, to discuss one, or if we had two of the applicants, we would need to schedule additional interviews. But if we had one that we wanted to recommend to the board, to schedule that in the next, or the first or second week of October.
Okay, great.
So I will not be here. So do you want to lead the meeting, or Chelsea had also recommended? So you guys,
It's fine.
you can do it?
Yeah.
Okay. All right. So we'll have Jen.
I don't know if anyone's talked about, when do you get back?
I get back the 14th, but if I'm in the interview and I'm comfortable giving you guys the final say.
Okay.
So yeah, I would want, you guys to, I can work with our administration, but as long as you guys bring over your final say, they can start moving the paperwork.
Okay, great.
Isabella, I think when you, because it's unanimous vote though in the IMA, your alternate from Northborough needs to be in that meeting.
Yes, Lisa.
Okay.
So I will send out a doodle poll just so we have 4 or an individual from each town represent. All right, perfect. And then the public health nurse, Taylor, just volunteered to help me with that interview. So that will likely be next week. So we have 3 applicants for that job. And then Jen, I will reach out once we start scheduling those other interviews in the next week. Any other questions about hiring or the process? Everyone okay with that? Perfect. And then some other news. So Jim Frederick is now officially a Westboro public health nurse.
Yay.
So we're very excited. I have already emailed him a bunch with his new email. So definitely I can forward that on because his Northborough email no longer works. So I will send out his Westboro email, which is super exciting. And then Southborough, I think you have a personnel update.
We do. So we're happy to announce that Taylor West is our new health director in Southborough.
Hi, congratulations.
So we're very excited to continue all the great work Taylor is doing, and she's still going to fill the nurse roles as part of her new role. So we kind of restructured on our side. So we're really excited about it. So
Great.
Which kind of leads us into our next discussion that we need to have. So happy that we are interviewing multiple nurses and hopefully get those done on the sooner side so they can start training, because I will be going out on maternity leave in December.
Oh, congratulations.
Thank you.
So much good
So-
news.
Yeah, so we need to kind of brainstorm and plan for how the coverage is going to work on that end, but yeah, very exciting.
Very, yes, I can
Taylor,
imagine.
when is your hopeful maternity leave starting?
It will probably be mid-December to mid-April.
Okay. Oh, the flu season, thank goodness.
Yes, I'll be home.
Okay, so December. All right, I guess while we're on that, so in my transition with my new role, I've removed myself from Boylston, Southborough, and Westborough's Maven just because it's no longer my position. Jen, I wasn't sure with Jim's new Westboro employee, do you want a backup? Like, do you want Penny on your Westboro Maven as a backup, or leave it as is? You can also totally let me know later.
Yeah, let me discuss with Jim and
Yeah.
see how he feels about it. Because I also can handle cases as well. And then Charlotte, as you know, does our TB.
Yes.
So I'll get back to you on that.
Okay, perfect. And then Taylor, Penny is already on your Maven, is that correct?
That's
Okay.
correct.
And then Anne Marie, I know Penny does all of the Boylston Maven. Are you on Maven or are you not?
No, I'm not on Maven. I don't have access to Maven for Boylston. I'm familiar with Maven from working in the school district in the past, but I don't have access right now.
Okay, and is that something your board would like you to have?
They did, but they felt, I believe Kristen felt that Penny being already on Maven, that they didn't need me. I mean,
Okay.
that's fine. I mean, I can bring it up in our next meeting.
Okay, let me talk to Penny. She wasn't able to attend this meeting, but she's at a home visit. But we can work on that just because it is important to have backups. With our new full-time nurse, that will also help out as well. But just important to consider, especially with people taking time off and all of that. All right, any questions about coverage, staff? Any other news?
So, no, I'll wait till we get to the next one.
Okay. All right, perfect. So without further ado, I will invite Rachel to, oh, I need to give you permission.
I think I can already.
Oh, you can? Oh, you're awesome.
Can I?
Yep, you're more of a pro than I am.
Perfect.
Thank you so much for being here. I know your internship ended. Rachel is a Tufts MPH student. She was awesome this summer. She worked closely with me and Penny to really develop some maternal and child health resource guides, as well as some recommendations for our region moving forward. But yeah, Rachel, take it away. Thank you.
Yeah, so as Isabel said, I'm a Tufts student. I'm in my second year of my MPH. I also work as a postpartum doula and a nanny, which I have a sleeping baby in my arms right now, and my friend Charlie. So if he makes noises, I'm so sorry, but he's chilling. But yeah, so I work very closely with families. I currently live on Cape Cod, so I'm familiar with the Cape area supporting families, but this internship allowed me to explore your area and how to support families there. Okay, so some deliverables that I was responsible for in this internship. We summarized some local health data, such as monthly birth rates by specific town, and then were they in the hospital or maybe were they at home, and what other information we can pull from that. And then other health data that Boston has published as well. To develop a maternal child health community resource guide for local pregnant people, new moms, and guardians, some educational materials for social media, and then lastly, just some recommendations for you guys on how to incorporate maternal child family health to meet the guidelines of the Public Health Accreditation Board. So methods, I conducted interviews with maternal health stakeholders. We talked about gaps in services, challenges in services, how would they like to partner or engage with the community, and then kind of chatted a little bit about what the role of local health is in maternal and child health. I gathered some data around maternal health from the Metro West Health Foundation, the Massachusetts Community Health Equity Survey, a survey that we sent out on maternal health needs, and then just general birth rate data from each town. And then lastly, I conducted a comprehensive resource and program search to identify any available or inaccessible resources. So these are the local birth rates. In general, these rates just show that like you have a continuous upgrow in population. Things aren't really declining too much, like you have the population to serve in this area. Some data from the Massachusetts Community Health Equity Survey showed some issues in food access, mental health, and healthcare access. So food access, 27% of pregnant individuals had trouble paying for food, including formula and baby food. 40% applied for or received economic assistance. 26% said they didn't receive enough, and about 30% said they received just enough. Mental health wise, about 20% reported very high psychological distress in the past month. 17.6% reported high psychological distress in the past month. About 6% reported suicidal ideation, and about 17% reported feeling isolated. So these are mental health is a really important one because it has a lot to do with the programming that we provide, or that's just provided in general. And then lastly, healthcare access. So this is from March of Dimes. 9.2% of live births in Worcester County in 2022 were to women receiving inadequate prenatal care. So these are simple visits, maybe to check the size of baby. Think about the gestational diabetes screening, any hypertension screenings that are done. So a good chunk of births in Worcester County, people were not receiving adequate prenatal care and checks. Next, 20% of pregnant or postpartum adults reported having difficulty paying for healthcare. Healthcare is just getting more expensive. We know that, but this is something that stuck out to me as well. And then lastly, the survey that we sent out. So there were 23 respondents total that we could use. We had more people answer, but the first question was like, have you had a baby? Or are you planning to have a baby? And if they said no, automatically not paying attention. Thank you for taking the survey, but that was the survey for you. But so 70% have or plan to attend classes. So some top classes that they are planning to attend or have attended included breastfeeding or just general feeding, childbirth education, and then an infant CPR. They noted that many classes are offered in the community within private organizations and hospitals. Some issues around these classes included the cost, the limited availability of them, and then just not being aware that they exist. So some top course requests, we asked people, what would you like to see? They said new parent support groups, childbirth education, and infant CPR. And then about those courses, they would like those to be held in person, which I think goes to show just how much people need community, especially in this period of their lives. And then we just kind of asked some open-ended questions, and those responses indicated how important mental health support, breastfeeding support, and all-around available education is to new families. And then I conducted a few interviews with a local pediatrician, Southborough's health director, Salem shared service coordinator, a maternal and child health specialist in Worcester, and a maternal nurse from the Visiting Nurses Association in Mass. And this is just kind of a word flow of some of my key takeaways from this time. So a big thing was support. That was just an ongoing conversation, support in different areas of the postpartum period, from mental health to feeding, to all things like that. A big challenge for a lot of these programs was funding. Many programs couldn't run effectively due to a lack of consistent funding, which again is a challenge for all areas in public health. This isn't something that's unique to maternal child health, but it's definitely something to focus on. Some other areas that were discussed included challenges within translation. So you guys have a lot of refugee families joining your community, and a lot of challenges with proper translation, both linguistically and then culturally. The way that they take care of their babies and they raise their babies is far different from how we do it. There are a lot of different little quirks and things like that that we have and they have, that learning about could probably benefit. And then input from interviewees on what the role of local public health is, including partnering with some other organizations that can help support this. So thinking about community providers, gynecologists, midwives, doulas, lactation consultants, things like that. Hosting educational workshops. I know public libraries are a huge resource postpartum, especially for baby play groups and things like that. So think about kind of connecting and doing like baby education or combining a play group with a support group at the same time and things like that. And then providing education online is another big thing. And then a big part of this project was the maternal health resource guide, which I can show you. So this was honestly like a larger part of the project, and this was completed. So this guide includes information on various resources in the area. I encourage you to go through it. I'll have Isabella send you a link, but it just has some resources both locally and then online as well for people to check out. A big postpartum mental health one is Postpartum Support International. That has a ton of resources. And then I also wanted to point out in the survey that we had, we asked people like what resources they knew of, and they all talked about Babies in Common and how helpful that organization was. And on their class offerings in the past, from what I saw last, they're not currently offering any classes, but when they did offer classes, they offered low cost registration for any families enrolled in Mass Health or WIC, which was really great to see. Let me get back to the presentation. And then these are some social media posts that I worked on, just educational posts and things like that. And these are my recommendations for you guys. Just social media for education, partner with organizations, engage with your community, and then educate yourselves about maternal health. That's really important. And then again, we're always searching for funding in public health. So that's something really great. In terms of education, I created like a book list that you could give to libraries, but if you wanted to read any of those books, those are all, they're not like complicated books or anything like that, that will help you understand. But yeah, so next steps, we worked on social media education. We connected with community members. And I know that a workshop calendar is in the works with your new public health nurse for offerings on maternal health education and CPR as well. So we were already pretty much starting at the end of my internship. So it was really great to see that kind of take place. But yeah, that's all I have. Anybody has any questions, I'm happy to answer, but otherwise that's all I have for you guys.
Thank you so much, Rachel. So that resource guide is actually already live on our gbph.org website. So new moms, new families can check that out. Jen, do you have a question?
No, I was just saying thank you. Good work.
I learned a lot from you, Rachel. So any questions from the group or comment, or even how we can implement this type of work? That's all right. We'll figure it out. Our nurse will be very important. We already do infant CPR, so that will be a great, we can advertise that a little bit more. And then partnering with other organizations that already do this work, the grant would be really helpful in, covering those costs and bringing those to the residents in our towns. All right. Well, thank you so much, Rachel.
Thank you.
I hope that baby doesn't cry.
Oh, he's good. He's awake now, but he's good.
All right. Good luck in school. Thank you so much.
Bye. Thank you, guys.
All right. Share my screen again. I forgot to go over this quickly when I was going over updates for the PHE grant, but I did make this request form at the end of the last fiscal year, but this will just be a great way for us to keep everything in line. So it's just an internal Microsoft form document. If you need to request anything to be purchased, go ahead and fill out that form. Hopefully not me, but the new shared service coordinator will look at this often, confirm that it is a approved expense through the grant, and then we'll give you guys the A-OK, or we can, buy it on your behalf. So that's just a new way that we can streamline purchases and make sure that everyone gets what they want, and also ensures that it is approved by the grant. Any questions? All right. Moving along. Okay, so flu clinic. So it's already that type of season, which is crazy. So the Salmon VNA services, they support some of our flu vaccine clinics, meaning they purchase the vaccines for us through our contract. So on October 8th, we have a town hall flu clinic for residents and staff. On the 15th, we have the Boylston Townhouse Clinic, and then we have our 4th annual Algonquin drive-through on Saturday, October 19th, sorry. And I know Southborough and Westborough are doing some other clinics. And then the last one not hosted by Salmon, Northborough partners, this is our 2nd year doing it. We partner with Wegmans to offer the seniors a high-dose vaccine flu, just because we do not have the funds to purchase those. Any updates, Taylor? I don't know if you have any updates, Anne Marie, for flu clinics.
I have an update.
Okay. Yes, Jen?
So, Westboro, the senior director purchased regular flu vaccine and the higher dose vaccines for our seniors, and then also for our staff. So that's what I don't actually have a community one
Okay.
set up, but I do have internal.
Okay. And please let Jim know to reach out to, I mean, we really only have Penny right now, but a couple other nurses can help out for any of those vaccine clinics.
Okay.
To do check-in or vaccine, administration is the word.
Yeah.
In Southborough, we're doing a few clinics. I have my large senior center vaccine clinic in the middle of October, and then I also go to the schools and vaccinate all the staff there. I vaccinate the staff in the townhouse, and I also reach out to all the daycares in town and vaccinate the staff at the daycares. So it'll be a busy next 2 months.
All right, you also, to reach out to Penny. We have Nancy, Celeste. We can also add per diem hours if we need to during the flu clinic season.
Yep. I will have a few homebound people that I will rely on Penny to coordinate.
Okay. Anne Marie, any updates? I know Penny has been communicating with you about those. I know there are 2 clinics on the same day, but.
Right, I was just concerned about the school district, if there was any left over, if we could do the staff at the schools.
Yeah, if there's leftover, so right now we only ordered 500 based on previous years. We have to let Salmon know the year prior, after the season's over, how many doses we want. So if we don't have enough this year, we can absolutely order more next year, but we can keep in touch just to make sure no vaccine is wasted.
I'm interested in joining. Sorry, go ahead.
No, go ahead. I'll say.
I'm interested in joining this for next year.
Okay. All right, so once we get that information about ordering for next year, we will absolutely bring that back to an advisory board meeting just so we can get the right number of vaccines. They only get standard dose though.
Okay.
Is anyone doing any COVID clinics?
We might be. I just reached out to the rep this morning to see costs. It's very cost dependent. We hopefully will be able to get at least a small amount of COVID vaccines and kind of trial it here.
Okay.
And I'll do that from my office kind of on a first come, first serve basis.
Okay. Jen, you're not doing a COVID.
No, we've not received any positive feedback about doing so.
Okay, and we don't have the funds. Anne Marie, I don't believe you're doing any.
No, I'm not. And I actually asked some people in the community, and I'm not getting any positive feedback on that as well.
Okay.
So.
All right. Well, that brings me to my next slide. So no positive feedback. That is totally fine. But the state does run a free program for those who are homebound or have difficulty getting to a vaccine location. So I actually did call them this morning just to make sure that they were up and running. So they were great. You can either call that phone number or visit the portal on someone's behalf or that patient to make an appointment. It is mainly a COVID vaccine program. However, if you get a COVID vaccine, you can also opt in to get a flu vaccine. You cannot just get a flu vaccine. It's just the way their funding works. But this is also an option, especially for our towns who aren't doing a COVID vaccine clinic. A great option. Any questions? I know Penny registered some residents in the towns last year and it went really well. Usually the appointments take like 1 to 2 weeks to set up. And then they arrive and it's pretty smooth. They do ask for health insurance, but if you don't have it, you can obviously still get the shot for free. All right, moving. All right, other nursing updates. So we are still doing CPR, AED, and Narcan training. So these are the updated trainings that we have. I just want to make sure everyone knows that these are an option. So if you are looking to schedule more of the trainings, feel free to reach out to me or Heather, ideally both of us, just so we're both in the loop, just because we pay for her hours. For the CPR and AED trainings, they have been wildly successful since we started. Usually they're booked within, a couple days. We do charge the resident the amount of the card. So typically that's $30. So your rec or library, we've been in contact with them, but if you want to schedule more, that's totally fine. And then the Narcan trainings are 100% free. It's just a 30-minute PowerPoint presentation. We bring the Narcan, those bags, you've seen them all before, but those trainings we are still doing. So feel free to reach out. Heather's still doing them for now, might change once we get a full-time nurse, but we will see what we get.
Isabella, how many seats are you filling for the CPR AED trainings?
That's a great question. I want to say 50.
There's like a maximum, Chelsea, of how many people should be in a class.
Yeah,
Yeah.
I think it's
And we kind of push the envelope a little bit as it is anyways. I think is it 8 or 10 that we're doing, or 15?
I think it's either 12 or 15.
Okay, that's awesome.
Yeah.
I'm glad to see that they're selling out.
Can you tell me if anyone has signed up for Westboro?
I do not know, but I can reach out to your library.
Oh,
So basically the registration links are through, Northborough does the rec center because I have no way of collecting money. Southborough, do you do it through your rec center?
Through
Okay.
rec, yeah.
And then
all
Jen,
right. I can just reach out to the library. I thought it
Okay.
just went through you for the nurse, the information.
got it. Yeah, I don't get the roster.
Okay.
And then feel free if any on the flyer, I do have like a template flyer that I've sent out to people.
Mhm.
Technically any of these clinics, sorry, not clinics, trainings, regardless of what town they're in, they're still for all
Mhm.
4 of our towns. So that is definitely like clear in the flyer. But just so everyone knows that as well. And it's a 2-hour training. And we've gotten pretty good feedback for that as well. And then all of these trainings are also posted on our website, so people can, check that out and see when our next trainings are.
Have you been seeing other towns actually sign up for other towns?
You mean like people from other towns signing up?
Yeah.
I haven't noticed that a lot for the CPR, but the Narcan trainings I have.
Yeah, I think, yeah.
Which is
First-
technically okay through the CMP program, just because not all towns offer it. But I don't think during registration we ask what town you're from, at least for Northborough, our rec
We
department.
don't either. So I have had a couple in the past where, like if you are, excuse me, especially if you follow multiple like Facebook or Instagram pages. So like if people from Northborough follow the Southborough page and they see it, they have the opportunity to sign up. And same thing, vice versa. Like we did one in Northborough and there's like 4 Southborough people in there. They saw it through an ad from Northborough because they followed them on Facebook. So
Oh, nice. I did have some, I think 2 residents that weren't from Westboro as well for the Narcan. I'm not sure about the flu yet. I mean, the CPR, sorry. That was just a question. I was curious about what trend everyone was seeing.
Yeah, no, I mean, that's a great question. We did add kind of a follow-up or I don't know, survey at the end of the Narcan trainings, but no one has filled that out. So I don't have any feedback for you. All right. Any questions about nursing programming?
So Penny is good to go to be added to Westboro.
Okay. So I will have Penny and Jim chat, and then I will, I think it's a pretty straightforward process. You just might have to write like a little email that you're
Yeah.
approving but that is great. All right. So I'm going to stop sharing my screen. I don't have any slides for this substance use prevention discussion. I just kind of wanted to open it up to see what each town was planning, doing, nothing, that's totally fine too. I can start. We really, besides having that consultant come and, prepare that report and present, we haven't had much time to focus our efforts on deciding how to spend that money. I will say for everyone, if you get a certain amount of money, you do have to report it to the state by the end of this month or October? October. Okay. I get like daily emails about it. So if you haven't done that or you don't know about that, let me know and I can give you that information. But has any towns made any headway with that? Any ideas? Any conversations you want to have about pooling funds? Anything like that? We can do
I
that.
think they're pushing regional, working together, so I am all for that. I think it'd be great. I think, also I'm hoping to be able to give Narcan out
Mm.
to our residents and
Mhm.
have it available here for free. So some of that opioid funding, I'd like to do that as well.
You mean free just so like they can come in and take?
Yep.
I would look into, I can see if we can just give you the Narcan, but the CMP program through the state, they just give it to you for free. So I wouldn't want you to spend money on that.
I thought there was limitations or what?
I think they changed. The first year, they definitely were like a training is required. But I think in the last year, I can definitely reach out. I think it's been less stringent on like what needs to
Oh,
happen.
good,
But
good.
I'll reach out.
Great, thank you.
And then Taylor, you Southborough is part of that as well, right?
Yep.
Okay.
And we do Narcan leave behind through the fire department as well.
Any ideas?
Other things I was thinking, I don't know if your schools have it, but in the report, it showed a lot of substances being used in the bathrooms, as we all know what happened. So they do have the alarms in the bathrooms. So I don't know if we could use that, some of that funding to upgrade or place those monitors in the bathrooms of the students for this, for the monitoring of substance use in the bathroom. So that's something we can look at.
Sorry, Jen, were you done with that, or I don't want to interrupt you? Sorry. We were interested in putting Narcan boxes next to every AED in the town public buildings. We're
That's a good
also looking
idea.
to get a secondary syringe drop off station outside of the health department. Also, again, looking to because Northborough and Southborough share a school district, try and get a what is it called? Like a
Curriculum?
yeah, curriculum, but like a what, not peer reviewed, what's the right word?
Evidence-based.
Thank you, evidence-based
You're
program for the schools.
same thing.
Right now, Southborough does DARE and Northborough does not, and it is not evidence-based. So we're hoping to change that. And we've been involved in talks with the school nurse lead on that as well.
Jen, what do you all do for syringe drop off?
It's right here in my office.
Okay, that's what we do as well. They have to come upstairs and Boylston.
We right now have one at, the only one is at the transfer station, and you have to have a sticker, which costs $300. So it also limits it to only residents who can afford it. We have a lot of group homes that drop off, and like I end up having to take them and then bring them. It's just not convenient. So I'm looking to expand that program.
But the transfer station, it is like a, just a drop box.
It's just a drop box, yeah. And that's what I'd be looking to have here.
And then Anne Marie, do you do anything? Does Boylston do anything for syringes?
Yes, we actually, in the Board of Health office, we have a drop off and we also provide containers for a few critically ill in the community.
Okay. Yeah, I think what are they're officially called like sandbox or something. The narcotics, the AED. You could probably do that without the box, but that is definitely something that I would be interested in, as well as just like dropping off the syringe. It's just a little definitely.
The other thing that I would want to look into, because we don't have any in public buildings in town right now, is kind of along the similar lines, but in the public restrooms have a needle drop box there. We only have them in the police station bathroom right now. Just like one of the wall ones for like diabetics and if people use in the bathroom.
And then Taylor, sorry to go back to this. So at the transfer station, what, do you have a company that takes them?
Yeah. It's like what is it, Waste Management, the common company that everyone uses. What is it, the one that you use? It's the same one that you have.
Can't remember. Okay.
It's leaving my brain too.
Yeah.
I'm like,
It's
does
there, but
it
it's
starts
you
with an
can't
S?
get it.
I don't know. Yeah, that program is incredibly popular in Northborough.
Yeah.
I would say almost,
Super convenient.
yeah. Okay, well, that is good to know. Jen, how do the alarms work? Is it based on smoke or vapor?
Yep.
Or okay,
Vapor and smoke.
okay, interesting.
I've seen articles about that recently.
Okay. One idea, it's, you know, kind of a long-term idea. So right now, Northborough and Southborough have the DFC grant. It's for 5 years. We would be looking to reapply for years 6 through 10, but it's super competitive. So just to keep everything open, I would like to use some funds to keep that position with us, whether it be a 4-town collaborative or you know, Northborough, Southborough. That's something in my head, just because I want to focus some of this money on prevention and staffing. But those are very early thoughts.
I'm open to, you know, helping the public. So I am on board pretty much for, I think it'd be best if we do pool. So, I mean, we can only support each other, you know?
Right, absolutely.
At our next board meeting, we're going to talk about kind of putting together a group of key people in Southborough to see if they have other opinions on what to spend the money on and kind of just gather feedback from the employees in town. But those were my thoughts as like the health department.
Awesome. Yeah, I can just leave this on the agenda for the next foreseeable future. I think it's good just to have the space to discuss. I know most of us attend the regional substance use prevention coalition through Hudson, but again, just to keep this space open is helpful. All right, anything else for our September meeting?
Are we going to go back to possibly a, whether it's part-time or not, for hoarding if funding is available after the hires?
Yes, so I think, so that was the contract through ClearPath, so it wouldn't be an actual like part-time position. It would be a contract of X amount of hours, depending on how much money we had, for them to be contacted or training, or them to, you know, basically be our liaison for hoarding situations.
Okay, great.
Is that something, I know, Jen, you're interested in? I am interested in it. So hopefully, so we're gonna meet back in December. Hopefully we would have hired all of our positions. We will know everyone's health insurance. We will also have a surplus because we didn't hire them right on July 1. So hopefully that's something we can go ahead and do upon approval from the state.
Great.
Anything?
Do we want to talk about maybe bumping our meetings up more than quarterly? Just because of the opioids and, you know, the funding, because we have such a hard time figuring out what to spend the money on later on. So maybe if we, you know, did it instead of quarterly, maybe every 5 weeks or 6 weeks, or
It's fine
I
with
don't
me.
know, I'm putting it out there.
Every like collaborative does it differently. Some people meet once a month, some people meet quarterly, and then anywhere in between. So it's really up to us.
So I guess I can make a motion to change our meetings from quarterly to every 6 weeks or monthly, whatever. I mean, after discussion, we can decide, but
Yeah, so well, I guess Chelsea would second it and then we can open it for discussion.
Sure, I'll second.
What if we just did bi-monthly? So it's like a month sooner, but it's not,
And then
that
it's
way we can kind of keep the same day instead of having it rotate.
that works for me. I like how I can remember what day it is.
Does
Yep,
that
that
work,
works.
Jen?
Yep,
So like instead of December 12th, it would be November
yep.
14th?
Yep. And then that, I mean, that sounds good to me. Anne Marie, any thoughts, Chelsea?
Well, the 14th of November, that's the MHOA conference.
Oh, right.
Okay,
Or-
good call.
We could do it the week before.
Yeah, we could change the day for that week. But how do you think about every 2 months?
I think that's a good idea. I think we have a lot
Yeah.
going on, so I'm supportive of that.
Okay, and then we'll have like hopefully 2, 3 new staff. They'll get to know us a little bit easier. More minutes, but that's fine. It'll be someone else's job soon. Those are coming along. I'm sorry.
No, I'll tell you, it's totally fine.
So I guess should we vote on that?
So I
Jen,
move to
Jen, do you
make-
want to amend your motion?
Yeah, so I move to amend my motion to meet every 8 weeks on Thursdays.
Second. Oh. Sorry.
No, that's fine. I paused.
All those in favor, Westboro,
Jen, yes.
Chelsea, Southborough,
Yes.
Boylston, Anne Marie.
Aye, yes.
Okay, and Isabella, Northborough. Aye, perfect. So I will send an updated calendar invite, and I will include that in my follow-up email. And then while we're on that note, we should change November. So whether we do the 7th or the 21st. Does anyone
Well,
have?
Isabella, on the 7th, it's in-person meeting for MHOA as well.
Oh.
So that they had a meeting earlier today, and that
Oh,
was the
that's
date.
MAPA, Jen. It's
Oh,
just-
excuse me. That's right. That's right. I'm sorry. You're correct, Taylor.
Okay. So does the 21st work for
That meeting is from 11 to noon. So we
Oh,
should
okay.
still,
Okay.
be able to meet after.
Okay, perfect.
I like the 14th better.
That's
The 14th
MHOA,
yeah, that's the
the
3-day.
big conference.
Oh, do we say the 7th or the 21st? Sorry.
No, that's okay. Or the 28th. I mean, hey,
That's Thanksgiving Day, so no.
okay, I'm sorry. Not in my calendar.
Let's do the 7th.
Okay. Does the 7th at 1:30 work for everyone?
Yes.
At least a quorum. Okay.
Yeah.
Perfect. I will also send that out. Anything else? Look at
No.
us, so productive. Love it.
Me too.
All right, perfect. Does someone want to call the meeting? Jen?
Sure. I
Move to adjourn.
thank you. Move to adjourn the meeting at 2:26.
Second.
All those in favor? Westboro, Jen?
Jen, yes.
Southborough, Chelsea?
Yes.
Boylston, Anne Marie?
Yes.
And Northborough, Isabella, I. Always a pleasure to see you. We will see each other on November 7th.
7th.
I will send all of that in an email. But have a lovely September, October, November, and I will see you soon.
And we'll talk soon.
Yes.
Isabella will be a married woman then.
I know, right? Mrs.
All right, Jen and
Bye.
Taylor, I'll talk to you about